Hi, my name is Dr. Ross Hauser. I'm going to go over a digital motion x-ray on a 26-year-old patient with Ehlers-Danlos syndrome who over the course of the last 5 years has had just unbelievable amounts of neck pain, migraine headaches, terrible. And a lot of it occurred after a cervical spinal fusion. So I'm just going to kind of go over why it's not a good idea to get cervical spinal fusions if you don't have to. We're in the middle of this patient's digital motion x-ray, and what we're looking for is when the person bends forward, does the vertebrae stay together? So you can see right here, see how the vertebrae are staying together. Now we'll then stop. So we can see on extension that the vertebrae are all staying together. This line right here is called George's line. Now we'll stop it at the end of flexion. Then as the person flexes, so the person's flexing or flexing, okay, stop. Now we see the cervical fusion here. This is C4, C5, C6. And if you take a line at the C4 vertebrae, at the posterior part of the C4 vertebrae, you'll see right here, there's a space right here. Then at C2, C3, see that space right there? That's the amount of instability. So this person above their cervical fusion has significant amount of instability, and it's that instability that's causing the severe muscle cramping, and also at the top level, which we'll see, is causing the migraine headaches. To view the C1, C2 facet joint area, the atlantoaxial joint, you have to point the x-ray beam through the mouth, and then what we're doing is having the person laterally flex and seeing if the vertebrae stay together. What you'll see on this particular patient is the lateral mass ends of C1 right here, and then the end of C2, the lateral mass is right there. So this space right here, that's the amount of instability this particular person has. And you'll see on the other side, it's very, very significant also. So if we could run the video. So watch this. Look at how much overhang there is right there. And then we'll do it again. See that? That's like 4 or 5 millimeters of overhang. And the same thing over here. I chose this particular digital motion x-ray to demonstrate the fact that if you get a cervical fusion, like this particular patient had a cervical fusion from C4 to C6, on their digital motion x-ray, they ended up having instability basically in all the segments that weren't fused. This particular person has instability at C1, C2, C2, C3, C3, C4, then they're fused at the cervical level 4 to 6, then they actually have instability at C6, C7. So the problem with cervical fusions is the motion then has to come from the other segments, and if you have Ehlers-Danlos syndrome or you're born with joint hypermobility or loose joints, it's a dangerous precedent where you're probably going to end up with instability in the non-fused segments. Fortunately, this particular patient, the prognosis for them for recovery is excellent because prolotherapy is great at stabilizing unstable areas from ligament laxity, because prolotherapy is a treatment of choice to tighten loose ligaments.